Hello, my name is Sikoryak, and today I'm going to be doing an abdominal assessment on my brother. I'm going to first ask for his consent. Is it okay if I do an abdominal assessment on you today and take a video of it for my class?
Yes.
Okay, great. I'm just going to show the room so there's showing that there's no resources that I'm using or anything today during this evaluation. Okay. Let's pick the patient. Okay. So the first thing is we're doing an abdominal assessment. I'm going to ask him to lay on his back. Before I would do a rapid ABCDE assessment. So when I first start the abdominal assessment, I'm going to look at the contour of his abdomen. I'm going to check his scaphoid, rounded, flat, and his umbilicus protruding. So I'm going to look at the stomach. And while I do that, I'm going to, look at the umbilicus, as well as I'm going to look at hair distribution, if there is any hair, making sure it's even and there's no patches or anything of hair. I'm going to look for skin lesions on the abdomen, as well as looking at if there's any scarring, if there's any tattoos, piercings, anything that I should be aware of. Okay, so you could go to that if you'd like. So after I look at the stomach, I'm going to listen to his bowel sounds, starting at the right lower quadrant, working my way around the 4 quadrants. I might auscultate up from 20 seconds to a minute. So after I listen to his bowel sounds, I'm now going to listen for his vascular sounds using the bell of my stethoscope. I'm listening to the 7 vascular sounds, and I'm going to be starting at the left lower, which is your femoral. So your femoral, then your iliac, then your renal, your aorta, your right renal, right iliac, and right femoral. Okay, so after I checked his 7 vascular sounds, I'm going to be putting my stethoscope away, and now I'm going to be percussing and palpating. So the first thing I'm going to do is I'm going to percuss CVA tenderness. So if you could sit up for me, you're right. So this is going to be detecting if there's any kidney infections or any kidney problems that you should be aware about. So I'm going to be percussing his kidneys, so I'm just going to take it and hit if there's any grimacing of the face or anything that shows signs of kidney problems. Okay. So after that, I'm going to ask him to lay back down, and then I'm going to percuss all 4 quadrants again. I should be hearing timpani. If I'm not, if there's any dull sounds or anything that could be a mass or any like an organ or something, if I'm over an organ, and if I'm hearing distension, that's hyper-resonant sound. So I'm going to first percuss around the 4 quadrants. With my 1 finger tapping. And then next I'm going to feel the liver. I'm going to feel right up here. And then I'm going to ask him to breathe in and then breathe out. I might feel the liver a little bit, 1 to 2 centimeters worth. And I'm just going to look throughout the face if there's any grimacing or anything, if there's any pain, and I would ask him to tell me if he feels any pain. The next thing I'm going to do is on the left side, I'm going to be checking the spleen. Typically, you can't really feel the spleen, so you should palpate, but you may not be able to feel it. So I'm just going to look around, and I can't feel the spleen. Next, I would palpate underneath him on his back, and I would be palpating his kidneys. Then the next thing I'm going to do is I'm going to palpate, so I palpated the spleen, palpated the kidneys, and then the gallbladder, I would check over by the liver if there was any, no, I think it's still, and then the gallbladder, I would palpate if there was any problems with the gallbladder. That would be a detection of the Murphy sign. So after I detect the gallbladder, I'm going to check for, use the Blumberg sign. It's rebound tenderness. So I'm going to look up and I push down straight and make sure that the abdomen comes straight back up and there's no sign of any distension or anything. So then I did the Murphy sign, and the next thing I'm going to do is the iliopsoa. So I'm going to ask the patient to lift his right leg up, and if he could, push against me, and if there was any grimacing face or any pain that could be a sign of appendicitis. So after I do that, I did all my signs on the gallbladders, the liver, spleens, and if any pain, I would document that, check grimacing, and finish my assessment, hand hygiene, ask if there's any questions, and finish my assessment.